Good afternoon. I'm Janie Bristow, a registered nurse with Northwestern Medicine. I work at Kishwaukee Cancer Center that's in DeKalb, Illinois. Thanks for joining me today to learn more about aromatherapy. I am filming at the Living Well Cancer Resource Center in Geneva. Living Well is part of Northwestern Medicine and offers free programs to local cancer patients and their families. If you have any questions or comments during my talk, please post them in the comments section and I'll answer them at the end of the discussion. So I just wanted to introduce myself a little bit more as we go through this half hour together. I have been a nurse for 37 years. I'm a local gal. I graduated from Rush University in Chicago. And have practiced actually in many states in many different arenas. The last 6 years I have been an oncology nurse. I am certified in oncology and really enjoy the actual sitting down and taking care of patients that are receiving care for cancer treatment and also for hematology treatment. I am fortunate to work with a great group of nurses and other healthcare people in DeKalb. We are always striving to improve the care of our patients and willing to look at lots of different ways to do that. So it's a really great team out there. One of the things that we have been looking at is aromatherapy. We have done an evidence-based project and also a research project with our patients, both recently. Aromatherapy, just kind of a little bit of a background. Aromatherapy has actually been used by humans for over 6,000 years. So it's not new to our race, but it is starting to become more and more a part of healthcare treatment. It is considered a complementary therapy when we're looking at cancer treatment. Aromatherapy sounds like it's only the smell that you receive, but it is much more than that. You can actually have it vaporized. You can have it on your skin, and you can also ingest it, depending on what your needs are. So with aromatherapy, we at the Cancer Center in DeKalb did an evidence-based project to help treat our patients' two main symptoms that they were having during chemotherapy, and that is anxiety and nausea. So we looked at using lavender for treatment of anxiety and peppermint for treatment of nausea. Our evidence-based project was overwhelmingly successful. People really enjoyed having an alternative to taking medications, and it definitely had many positive outcomes. Our nurse educator, who is Lorraine Mack, is an advanced practice nurse who was doing a research project in the hospital, very similar to our evidence-based project, with amazing results as well. We did a literature search, and found that there was not a lot of research done in the outpatient setting. So that gave us a chance to go beyond just looking at the evidence and making new knowledge through research. So she set up, as the investigator to the research program, a system where she used the West region for Northwestern Medicine, and that included cancer centers at Delnor, Warrenville, and Kishwaukee. So there were 4 co-investigators. I was one of them, the one that worked in DeKalb, that actually did the hands-on obtaining of the data. Our goal originally was to study 40 people's response to whichever aromatherapy they would like to try, the lavender or the peppermint. It was set up as a quasi-experimental project, which means it was not random. People chose what they wanted to do, whether they wanted to be involved in the project or not, and then what aromatherapy they wanted to use. So once we had our project set up, and this took loads of time. It was actually started by Lorraine in 2018. And she has a very nice timeline set up. She got her project all set. It was reviewed by an internal review board that says whether or not it's a go, it's a good setup for research. There's not other research that is available that actually says the same thing that we're doing. And this internal review board asked that we get FDA approval for the aromatherapies, because even though we were only using them with the patients actually just diffused and smelling it, the aromatherapy products could also be ingested. So we had to step back, go to the FDA and get approval from them before we could move forward. When we were ready to get started, that's when COVID hit. So we had to revise our plan again and get approval for using that, because everybody's wearing a mask. With the aromatherapy, you are required to take the mask down to use the aromatherapy. And so we had to make sure that was an okay thing for us to do, and it was. And then we obtained, took us about 9 months to obtain the data. As a co-investigator, I was required to not only consent the patient by giving them materials and that they had to actually sign, keeping that information under lock and key, providing education to the nurses who would be administering the aromatherapy to the patients, and then also obtaining the data, meaning the questionnaire afterwards, how well it was received. And all that information was kept under lock and key as well. So that we were able to finish that information and tabulate the results, and overwhelmingly people really enjoyed the lavender for treating anxiety. The folks that chose peppermint also were very happy with the results, but I think really the lavender was the one that actually most people wanted to experience. And they were allowed after the study, which was once. They used it once and went through the process. They were allowed to use it anytime they want, and at this point are still allowed to do that. So I have a teaching tool here about how we dispersed the aromatherapy, because at the setting in DeKalb, it's more or less open air. So we had to take other people's needs and allergies into account as well. So this is one of the products that we use, and that is a Young Living product, which is endorsed by Northwestern Medicine. It is a therapeutic grade, which is what you want to look for, and this is the peppermint. Okay. So we would identify anyone who, and still do, who wanted to use the aromatherapy with a sign that would go on the doorway. So anybody that would be coming in would know that aromatherapy was being used. And we have a Ziploc snack bag. And also a little medicine cup with a 2x2 gauze. And so this product is the peppermint that I'm actually going to drop on there. This is one of mine from home. So 1 drop of peppermint goes a long way because it's so concentrated. So you actually just want 1 drop in there. Lavender, we usually use 2 drops. Okay, and that's it. Okay. I can smell it. It's actually very nice. And then that goes into the Ziploc bag. This is done in an antechamber away from patients. So there's really no smell to anyone else. So we bring it to the patient this way. And then when they're ready to use it, and they're allowed to use it as often as they want to, as many sniffs as they want, so they can take their masks down and then just open the Ziploc bag and then smell as many times as they'd like. And then at the end of their chemotherapy session is when we would question them as far as how well the product actually worked. Moving forward, we do have all of our data tabulated. We will be disseminating the results by publishing that information in Nursing Journal, incorporating it into a policy. I believe the hospital may already have a policy in place, and this will be for the outpatient setting for Northwestern Medicine. And then it opens the door for future studies with aromatherapy as well, gaining the evidence that shows that this product actually does work, helps us to be able to look at other types of needs with our patients as well. One of the aromatherapy products that is being looked at is frankincense, as far as helping to decrease inflammation. So that's something that may be coming down the pike as far as what we study next. Okay, and that's pretty much all I have to provide for you today. Is there any questions?
We do have 2 preliminary questions, and I'll have you answer these if you could. And the first one is, where can I get essential oils? If I'm, just an average customer, where would I find these?
Mm-hmm. There are a lot of essential oil products, and they are not all the same. What you want to do, like this is Young Living. I know there are folks that sell this product. You can look online too at youngliving.com. You want to look for something that is therapeutic grade essential oil. Because like I said, not all products are the same. It can be very expensive, but something that's clean, that you're going to be inhaling, it's important to make sure that you get a good product for that. I didn't talk very much about diffusers, and that's something that a lot of people that have been interested in using essential oils either have or are thinking about getting. And that's the same thing. You want to find a good, reputable company that's going to be able to give you information about how well the diffuser works and what kind of oils work best with their diffusers. There's many, many, many products. And that would be something that you would use for your private use, because it does actually spread throughout the home. And hopefully that answers that question.
Another question, is it safe to drop essential oils into bath water?
Again, there are many that are, but there are some that are not, that you don't want to have come in contact with your skin. So when you do your research, when you're ready to buy a product, make sure there's information that tells you whether or not you can use that.
A question has come in. Jan is asking, how do you sign up for this therapy if already taking Keytruda for maintenance every 3 weeks?
Well, Jan, it's available to all of our patients at any time. We still have our system set in place to use that. When we were doing the research, it was on every nurse's mind. So I think it was easier for us to be talking about it. Sometimes when we have things that are not mainstream, it's harder to be aware of those things. So when you come in for your Keytruda, just ask for either product. We can actually do both products if you would like, and it's available every time you come.
The brand name again, someone's asking, it is Young Living, right? Just so I...
It is Young Living. I don't know if I can hold the bottle up. And I'm not a Young Living representative, but this is the product that Northwestern Medicine has asked us to use. And that, again, that's the peppermint.
It does not look like there are any further questions. So this was wonderful. Thank you so much. Yes, thank you.
Well, thanks for having me. I really appreciate it.